Fambul, good afternoon and welcome again to the second half of the program Wel Bodi Tok, where they come to you live from Radio Maria Salon, the Christian voice. Now you host the program. They come live now with 4th floor studio 10 outlets na Freetown na FM 90.9, then Bo na 91.7. Kenema 90.7 and inside McKinney na 101.3. Members say the phone lines they open for call and make you comment. 079-900-907 or 077-315-147. Members say you call important. You can call and add your voice to the program. In the first half of the program, Dr. Baylor don't take us through waiting a male infertility. And the topic where we talk about today, now a question where they ask we say, do you know that men too can be infertile? The answer na yes. Man themselves they're not able for make woman get belly. And reasons then they where Dr. Do explain the first half of the program, don't tell me about the male reproductive system waiting at the organs them we make up the system. And some of the problem we can affect them systems there and organs they are inside the system we can make some man not able for give belly. And same way so one of the one we stand out now infection where mostly if the man they don't treat them well or they not completely treat them when them put them on treatment, it can be problem. Or some not can open up for go to hospital or for go and seek advice, or not can open up for tell their wife them for make them find the way forward. All the other important things they inside the program for you today. Stay with we the few minutes where we get for wrap up this program. Doctors, we don't talk about waiting at the male infertility, and the same way so don't tell people in the percentage that 13% of the man them we don't the inside married themselves can contribute for the woman not get belly. And you don't also tell waiting at some of the cause them and waiting at the thing that what we they see the signs and symptoms where the man go experience we go make say now this kind of problem they go through. Now we go want for know the age where man then they stop for ejaculate. In the first half, you don't tell we say at times the man can get premature ejaculation, at times the man can get retrograde ejaculation. Rather than with the ejaculate into the vagina of the woman, it can be in the reverse. So we want for know when man then they stop for ejaculate and waiting at some of the eats them where man then suppose for the take, because we get myths na Sierra Leone what we need for correct mostly the man can say whether it's raw granite or whether it's raw cassada or whether in charm or rest as the case may be, all that to help them forget a good sperm count. So we need for correct that myth today and give fumble them the other thing the way they need for know. And from the first half of the program also Giselle asked a question where I think I don't show you in the first half, so you can use all that as an opportunity for address Giselle in question and the other one there.
Thank you very much, sister, for coming back. And Fambuden we tell una thank you for una they listen, and we don't get a question from Giselle. A very important question, and that is actually the topic of all over Sierra Leone. Even as somebody begin talk about male sexuality, that's one question we can always come up. And the question is, is it medically advisable to use drugs for sex? I go answer yes or no, depending on the circumstances. No. Why no? I can tell everybody, normally when people ask me this question, I can tell you, say, if you are normal, nothing is wrong with you, physiologically okay, your system all right, there is no need for make you take drugs for sex. But if you have certain challenges, because even all the conditions we don't highlight now, waiting they cause infertility, is there is problem with your organ, or there are situations wherein you have erectile dysfunction. We have drugs with enhance erectile dysfunction that are able to erect, and some of them drugs and they only take out on the advice of your medical doctor. So why I say yes or no is, if you go to a medical doctor He examine you. He know exactly what is your problem. You explain to him your signs and symptoms. In a trained and qualified doctor for then kind thing then he go advise you better, and he go even advise you, maybe put you on a drug where go enhance you for the produce ejaculation, or also it even advise you for take drugs for increase on your sperm count, or it go even advise you for take drugs for get ejaculation. All them one then you get drugs then for them one then like the commonest drug where it really they around where people then, in fact it is being misused now heavily, is the sildenafil citrate. Sildenafil citrate, what would they call, like most times originally it was commonly called Viagra. Now they come in different forms. You even have liquids one now where you can easily suck. You get a tablet, 100 milligram, 50 milligram, they're all over the place. So one of the work is really to enhance erection, but you do only take her on the advice of a medical doctor based on your own condition where the medical doctor see. But it is being misused now. Everybody they take a jack, and whether a normal person, nothing wrong with them, I go advise say make you avoid them. May you not take them. If you are normal, your system is okay, you can ejaculate and even have sexual desire, everything, you don't need it. But if you have conditions and you only take it based on the doctor's advice, then let's go to if age they meant for stop, if any age they meant they stop for ejaculate. I can tell you say no specific age not there for man where they stop for ejaculate. But however, for age, as age they advance, from then 70 now, from them, let's say roughly about from 75 to 85 now, they find out say even the sexual activity of a man they reduce. That's the only thing, because but it still produce sperm, it still ejaculate, but in sexual activity they reduce. In fact, as I was reading literature, or if you read literature, they tell you say some age that they like 60. Some man they tell you so the research has gone on that men normally, even with the presence of their couple, they can only get like 2 or 1 times a week. Some man the research don't prove say some man say where you don't pass 60 now, they go to 70. So then 110 they get per week within couple. They get that within couple. Or some man can tell you say 210. Or some man can even say if you don't do that 70, like you say so 10 1 month, now 1 or 2 10 no more. So as age they advance, that desire they reduce, but it still produce sperm. That's obvious for man. Then we can go quickly to the basic food then, where really they help you forget hard. Normally, I read some book, they tell you say for enhance you, but forget the man very hard. And one of the food what they recommend is watermelon. Watermelon, very good, the seed and everything. In fact, some people they eat watermelon, they jam all the seed. Watermelon are one of the food where it's very good. Pumpkin seed is also very good. Again, it gets some component there, but because of time, we can go into all the components. I may we'll forget maybe this topic I got advice. We even repeat them. Some of the components that they will be able to go into them and tell the people they're waiting at the benefit. We'll not go just say pumpkin seed. Why pumpkin seed? Some people go and know the details of that for jam. So, but with time, we will find time again for let we come into the intricacy, the technicalities of those food the way they call. Spanish or other leafy green also is very good for man. That they increase you sperm productivity and activity and even the motility of the sperm. Also coffee. Some people get in own side of issues. Some people other school of thought, but coffee for sperm actually is very good. They get a content what they call caffeine. Caffeine for they help they relax the smooth muscles of the penis, what they call the corpora cavernosus. Now they smooth muscles there, they relax them, and when it relax them, it help the blood the flow through the blood vessels into the vessels, then the penis they erect. So coffee also is very good for erection. Dark chocolate dark chocolate also chocolate wey na the dark one also in itself na the same way they do the corporal cavernosus, that spoon muscle is a relaxant, then blood vessels they become engorged and blood dey flow, then of course it enhance erection. Of course, even the sildenafil citrate wey I call so, wey a lot of people they misuse and now they take out for sexual enhancement. One of its basic function is na a vasodilator. It dey dilate the blood vessels of the penis, then blood dey flow in. Because erection, all about erection in simple terms is now blood dey flow. Then when you get a sexual urge, the brain they signal to the nervous system, then the system they communicate with the blood vessels, and blood they flow into the penis, then the penis they erect in simple terms. Then also you get salmon. Salmon also very good. You know that fish what they call salmon is very good for sperm production. It also enhance sperm motility and actually the production. Then nuts. Maybe this is where a lot of people they get this meat say when you eat granite and all the rest. Not generally, especially granules and others, it increase sperm production, it increase sperm motility, and also it strengthen the sperm. Then also we get what we call nut. One of the key things we do, we get the high density lipoprotein, we get low density lipoprotein. These are fat actually, but the low density lipoprotein is more dangerous than the high density lipoprotein. So the nut they help for produce the high density lipoprotein, and this high density lipoprotein they help for remove the low density lipoprotein back into the liver, where it not go deposit along the walls of the blood vessel, where they help for block or for even cause hypertension, where they lead to even infertility. Also it cause that the almond also can lead to, these are the organs. Orange, these are all the food where we need. Blueberries also, they all they have. Spicy hot food, spicy food like hot pepper also, because hot pepper it get a what you call capsaicin. Capsaicin can help also for the production of, for the free flow of blood into the blood vessels, and hence the flow of blood into the penis they cause erection. So these are the few food where we really can advise for make you eat for let you, the sperm become very hard, and then you do sexual activity very good, and then infertility, for avoid infertility. Thank you.
Thank you, doctor. So that now some of the food them where doctor don't name, so. And we don't get previous sessions where some of them food they are still they come up watermelon,
Yes.
The nuts, the dark chocolate, all of them food they don't they come up where it gets in time way very good for man as well as woman in growing and all. So do you demand them? Some of the myths them they believe so get say oh we charm this or oh take this or oh make so na problem. And also from Giselle the message don't tell una say una the young people they learn una take note. You will feel say you know you pass you take medicine before ever you feel say you go able forget mommy and daddy business. You get for take note of the consequences of denting and it. And so doctor for let me go wrap up, as you say time indeed not enough, because we need for no more the emotional support of them people where they go through. At times now the wife then they go through the challenges, whereas the man not even know say now he get a problem. But one good news is that out of the 13%, of course 87% they will possibly they're fertile, or even then 13% here if they go and they identify waiting at the problem, if that way reversible, then you be able for be cured and able for make the woman conceive. So okay, now let doctor give advice, the final word, the lifestyle modification we demand them for do for men and help for look after them well body one, so that in the future or presently if you married or you dey long forget speaking, let you look at some of them things there. So for go see doctor, whether you get for do semen count or you get for do different tests, you get for do ultrasound, or then get for take proper history, or you get for ask you family history for know you papa inside or you brother, any of them they don't go through that challenge day, or waiting are you own lifestyle, because I think the lifestyle is now one, the
Very
smoking,
important.
the drinking,
drinking.
then the use of this tight thing that we then can use when I can get that advice for the testes, for protect themselves and all of them other things there. So you can give final advice to the man there, and any other more questions they wanna get, the radio line open, and when I go come and visit, and when I go get time also for talk with Dr. Bill or any other doctor, any other well body workplace, you can walk in and go with your partner more when are able to find a way forward.
Okay, so thank you. Quickly, Fambo, smoking, we for avoid smoking, we man them because it lead for weakening we makes the sperm cell. Also, alcohol drinking is also we need for refrain from her or even more, reduce them drastically. Then certain medication, of course, certain aged medication like antihypertensive drugs, certain like captopril and all that, for example. Then we get certain diabetic drugs, we get some psychotic drugs, and one then they all, if possible, they on them, you get for the visit your doctor for making the monitor your sexual activity. Then the key point, then briefly 1 minute, you always get some exercise. Exercise is very good. Then also, not always, like some people they always breakfast sit down inside hot water within the walls, man them. Too advisable, if possible, not sit down there for long, because it change the temperature of you, of your scrotum there, it even help for kill your sperm. If it was with warm water, was quick and commode in, but don't go sit down inside, they call them a hot bath. Don't sit down there for long. They encourage you to do that for long. It kill the sperm them of the scrotum. Then also, semen is normally whitish. If you see anything whitish gray, if you see your semen, the depositor, a color change, go meet your doctor straight. Tell them. Then also vitamin C, very, very important. But they take vitamin C as much as you can. It help in an antioxidant. It help for also prevent or protect the sperm DNA from the radicals then they way they damage them. So vitamin C also very important. Then also do, like I don't tell you, exercise, quit smoking, take plenty of vitamin C, then avoid steroids, too much of steroid intake. Then opioid also avoid it. Then do low fat intake. Like I don't tell you, not take too much fatty food, low fat milk. If you want to take milk, the one way not get beaucoup fat. You get what you call the low fat dairies, where you get less fat. Milk way now non-fat anyway. Non-dairy foods them. It's very good. Then also banana very good also. So now for eat enough banana, they help you. For even this one, they help even the motility of the sperm and also even the strength of the sperm. Banana. Then of course, I think shortly, because of time, really these are some of the drugs when possible you get for the watch your fertility. Like I don't say the antibiotics. It can help for medication that temporarily reduce your sperm production. You get antibiotics. In fact, that's the reason why we can always say not take antibiotics no more until they prescribe for you. Then also anti-androgens. Male hormone than androgen. So if they take any drug where they counteract that the production of androgen, it lead you to infertility. Psychotic drugs, antipsychotic drugs. Then the one that what you call psychotic, maybe in a big word. Then one that where they can get some mental problems, and then they give them drugs. Then they also opiates, the antidepressants, anabolic steroids. That one they all when you take them. Then methadone, a painkiller. But mostly where they take them for long, I make where they take them. They go for them also test you sperm viability, all that thing in there. But because of time, now I make a tell the moderator, we get for really find time for going into detail about this topic. Now a very broad topic. Thank you very much.
This topic now a very broad topic. So if you don't know say the man themselves can be infertile today, you don't know say the man them can be infertile. 13% of them can be infertile, but yet it can be reversible if then go see doctor. If it's in a condition where you possible, then can treat them. So if you na man and you they get difficulty in ejaculation, you they get low sexual drive, or even they lack the feeling for get sex, or you they get pain, or you they experience some swelling, or any of them thing the way doctor say, you they get retrograde after sex for let you ejaculate, you they see say nothing no they come on, and after they come out, then you need for see you doctor. And when you they go see you doctor, not forget say you get for make list as doctor don't talk all the drugs the way you don't they take, or waiting don't be your lifestyle. So doctor go able for no advice you say for say yes I be the smoke, or yes I be the drink. When you talk the truth, there are times when you are open up, then they know the right way, but if you go you begin conceal some other thing, now a challenge. And it's advisable that when you go see doctor, you go along with your partner, because when you go along now all two get for engage, you get for know when in your fertile time, or when you self go able for do so, or you go able for do that, you go able be a support to you, because some of them here where they go to you need emotional support. So you need for ask also your family history for let you know any of them challenge that way they go to. If any of them we don't go to, especially the male line, your papa, your brother, your first line and all. So we get for take note of all them things that write down your personal information and any of the things them. So you go and see doctor, you go and see doctor with your partner, and wanna find the way forward and be plain enough, be bold enough, and try for the observe yourself and see waiting now the problem. Because remember I say infertility, now where you they get sex unprotected with your wife for 1 year, unprotected, uninterrupted, unprotected, you know, use no means for say I know let this woman get better, then the woman not get better, then you don't know say na infertility. If you be for more na married na so don't they happen na no ever born, they call them primary, but if una be don't born one, then after that the woman not they take no thing for say I no one get belle, the man say no they take no thing, the woman na when infertile or all as the case may be, everything now una they do, then unprotected sex for 1 good year, nothing no they happen 12 months, belle no come, they will call on the secondary infertility. So you need for go see doctor, una need for explain for me they know waiting at the thing. Time don't be too as usual. One will tell una thank you. Me will bring the program come to you, me na Gifty Masako and me special guest and co-moderator Dr. Samuel Bello. We don't there. So I will tell you now, but thank you. Time don't get. But any question we go cancel on back. So left on now in the name of the Father and of the Son and of the Holy Spirit. Amen.